So welcome to the session. My name is Marty Walsh, and I am the Executive Director of the Hand Therapy Certification Commission. And as I'm sure you already know, HTCC is the organization that grants the CHT credential and maintains it as well. Today's session is designed to talk to three panelists to find out why therapists pursue the credential, the impact on their careers and on their patients' careers, and how they prepared for the examination. So we have three panel members with us today that are going to talk about their study strategies, how it's impacted their career. And we also have Carrie Landrew, who is on our board of directors as the president. She used to be the examination director of examination services, so she knows everything about the exam inside and out. So if you have any questions for her as well, please feel free to use that QR code. So the QR code is here, so if you want to take a picture of that to submit any questions, I'll keep this up for the entire presentation. So without further ado, I would like the panel members to introduce themselves and to share your professional background, kind of what sparked your interest in pursuing hand therapy, and we'll start with Sophia.
All right, great. Hi, I'm Sophia. I've worked a little bit.
Is it on? It is now, yeah.
Hi, I'm Sophia. I am a CHT that just passed last May. I've worked in private practice for a little bit, and then I decided to pursue a hand therapy fellowship at Stanford to continue my learning because I felt like at my private practice there were certain things I got really comfortable with, but I knew that there had to be more outside of hand therapy than just doing trigger fingers and carpal tunnel. So I decided to pursue kind of further learning by applying and being part of the fellowship at Stanford. And then after that, I had actually got hired, and then now at a different location, and now I'm actually part of a different fellowship's faculty and lecturer. So, yeah.
Great.
That.
Hi, everyone. My name's Katie, and I've been an occupational therapist for 20-ish years. We'll just go there. And I recently passed last November, and my story's a little bit different. I've been working in and out of hand rehab since I was a new grad, but I've been an inpatient. I did a spinal cord injury, a specialized unit rotation, and I've always bounced back and forth back into hand. I worked in New York City for 15 years, level 1 trauma centers, and I've always wanted to sit for the exam, and I talked myself out of it several times, and I'm really glad that I really, found the time and the motivation and the goal setting and kind of whipped myself into shape. And now I work in a private orthopedics practice directly with 2 hand surgeons in a physician-owned surgical center. So they have me in the ORs with them, and it's a huge learning experience. And I definitely say that this credential really was what propelled me to even convince myself that I could get that job. So there you go.
Rachel.
Hi, I'm Rachel. I currently work in an outpatient hospital-based clinic in Flagstaff, Arizona. And this is my second career. I originally started in the field of architecture and really loved building things with my hand and exploring 3D printing. So that was sort of my background. When I decided to go back to PT school, I was really interested in the feasibility of 3D printed orthoses. So that's where my love for orthoses really started. And I decided to pursue hand therapy after working in the inpatient setting and the emergency department. We had a position that sat vacant for about a year or so, and they had a really hard time filling it. So I decided to step into the role, and I did not really have any on-site mentorship. I had a lot of mentorship through an outlying clinic about an hour and a half away. And so pursuing the CHT credential was a way for me to have a way to actually sit down and learn what I didn't know. and it was really helpful for me to have that time and that space set up. I serve a population that's very diverse, including patients who drive 3+ hours from Navajo Nation, and so I wanted to make sure that I was providing the best care possible for them.
Thank you. And Carrie, tell a little bit about yourself.
I'm Carrie, and I'm from New Orleans, Louisiana. I have been interested in hand and hand function since the first day in anatomy class in therapy school. I just loved pulling on the flexor tendons and saw what they did, and it piqued my interest. I took a hand therapy fellowship program the day I got out of therapy school, and then I had to wait 5 years because that was the time frame back then to take my CHT exam. So I've been practicing and working on hands since the first day of anatomy. I truly love it.
So, Sophia, thinking back on your decision to become a CHT, what was your biggest motivation for taking on this challenge of certification?
I think in general in my career, I just wanted something that I'd want to still like work towards and look forward to. And I think for me, like having that CHT meant like I'm gonna be learning outside of what I'm currently seeing in my clinic, because hopefully maybe once in a blue moon I do get something that's, you know, a more like traumatic injury or someone that, you know, it's kind of like trying to figure out that puzzle piece of like, why is it that, you know, we couldn't get them to where they were. So I think I wanted to do better by my patients, regardless of what setting, and for me it just happened to be in hand therapy. But I think also, because I had a really good CI when I was doing my level 2 in hands, that kind of pushed me forward to kind of do better, but also just for my patients. They could be family, they could be friends, they could be just someone off the street, like you want the best for them.
Okay, great. I think I'm going to ask you the same question, but I'm going to change it a little bit.
Sure.
Since you made your decision to pursue it after 20 years of being an OT, so what was your motivation after all those years to finally get it?
I mean, to be honest, I think I was a little burned out. I think I was needing a new direction. Early on in my career, I was working in hands, and I had a supervisor that told me that they didn't really see that for me in my future, and I can't stress this enough. If someone says that to you, walk away and ignore it and find your voice. And when you're young, those words are really powerful, and it still is in my ear. And when I got the notification that I passed, that person was the first person that I thought about. And I wanted to just stick it to them. And I was really kind of like annoyed that I had let that influence my career. And I mean, obviously, like I pushed myself and I had gone in other directions, but I always came back to this because I was always really passionate about it. And I just decided that, you know, I'm looking down like the back half of my career. Do I want to be excited? Do I want to be, I want to keep learning, and I want to be challenged, and this really was an excellent fit for that.
And for Rachel, since Rachel is a PT, the other two panelists are OTs, only 15% of CHTs are PTs, and we would like that number to be more. So kind of answering that same question, what was your motivation as a physical therapist, and now that you have it, what does it mean to you?
Originally, the job was an OT posted position, and we live in an area where it's actually very costly to live, so finding people to move to the area was really difficult. So I think the fact that they took a chance on me even to train me in that position or allow me to learn in that position was something that was really unique, because sharing patients with our outlying clinics is actually really hard as a PT, because you can't see the same patient unless the OT also evaluates them. So it's, if I go on vacation, that's really, really difficult. So trying to find ways that my patients can still get care. But there was another PT in the area who had recently retired from hands and provided a lot of great mentorship as well. And I think the important thing is that the patients in the area are getting the care that they need, because right now, if I wasn't there, or if there are, I think maybe one other CHT in our area, Also, if they weren't there, then this population would not have anywhere to go. So I think having the CHT credential has done a lot in terms of building confidence in the surgeons in the area, in me as a PT rather than an OT. Knowing that I'm motivated to acquire that knowledge and work with them to best treat their patients, and serving that population.
Great answer. So let's talk about the study process. Who would like to talk about their overall study strategy or their study process? You're all going to get a chance, so.
For me, I hadn't studied for a test like that in a really long time, so I took a while to just kind of figure out how to study again. And was I someone who needed a quiet environment? Did I need a more distracting environment? So I was, the environment was important, so I tried everything. I was in college libraries, I was in coffee shops, I was at home, I was on my lunch hour at work. And then I used, several different platforms. I think the one that I found the most effective was the virtual hand-to-shoulder CHT prep course. I used the ASHT test prep book. I used the purple book. I gathered all the tools, right? And then I went old school, and HTCC has flashcards, like virtual online flashcards, and I hand wrote them, and I put them everywhere. They were in my car, they were at my bedside table, they were at work, they were everywhere, and just the writing them out helps you learn the content. And then I was just, if I had a free moment, I felt like I was doing something. And then closer to the exam, I worked with my manager, and I worked half days so that I would get my kind of 2 weeks before the exam, I was only working half day, so I could study the second half. I like to spread it out, and then it was about overcoming like the mental fatigue. It's a 4-hour exam, and if you haven't focused like that for 4 hours, it does take a lot of practice. So I would simulate the exam setting, I would do the practice tests, I would kind of take notes as to like where was I kind of dozing off or where was I getting tired, and I would try and like come up with strategies. I literally had like a bathroom break strategy for the test, like when was I going to get up, and force myself to get up so I could come back refreshed and not feel rushed. And I used the rehab of the hand, obviously, because the learning platform from virtual hand to shoulder really gave you a guideline. I had a huge wall calendar on my dining room, and I would cross off the days with the content. I really went like full bore, talked to my friends, my family, my partner, and was like, listen, this is a huge commitment. I'm gonna be gone for a long time, like studying. And they were like, we get it. But I outlined it for them, so I didn't feel like I was being pulled in multiple directions. And this was just like a chunk of time that I really dedicated to myself.
Sophia, what about you? And what about you and some of the resources that you use to help prepare?
I would say my biggest resource was Hand Therapy Academy. I really liked how they had like that 6-month program, so that's kind of what I started with. But I think the first time when I had studied, I think I had put a lot of pressure to like pass it within that 6 months and like strictly following their timeline. So truthfully, I had burnt out. So I ended up not taking the test like when I initially thought. So the second time around, I gave myself time to breathe and just do what I need to do. And then so after that, I still went back to Hand Therapy Academy because I really liked how they outlined everything, and they had a calendar. But I think because I had already gone through it once already, it didn't feel like my first time studying. Because for me, I need a lot of repetition. Like I can't learn one and do one. That's really hard for me. So I like put out all their dates. I went through their calendar, but I also put like fun stuff that I could like look forward to. So if my friends had a birthday, I'd like put that on the calendar. So I'd have something forward to look forward to. But then because I had done Hand Therapy Academy already, the second, like closer to the exam date, I actually did the ASHT review course online, which I thought was really, really helpful because I really like watching the videos and just having it repeat. So like if I had a patient cancellation and it was something that I wanted to review, like I felt like I had the space to like review it rather than learn it for the first time in like a 45-minute gap between patients. And then my other one was I really liked the Purple Book. So even though like most of the questions are relevant to the test, like of course there's gonna be a few outliers where it's like, it's very detailed, so it's like, okay, well don't trip over those questions, like focus on like the main content at hand. But I think the biggest thing for me was just like do, you know, be hands-on, like be visual. Like for me, I knew that podcasts weren't my thing, so I just didn't even try with podcasts because I'm not an audio learner. But I think also just spacing it out and just giving yourself time to breathe was like the biggest thing for me.
Okay, thank you. A lot of those vendors that you mentioned, and Katie too, I think are here in the exhibit hall. Like the Purple Book, I think is given by Exploring Hand Therapy, and I think they do have a booth here. Same question for you, Rachel.
I actually started with the MedBridge program because our work provides that as an HEP system, so it was already built in. But found that I didn't do very well with self-paced learning because by the time I was done at the end of a workday, I'm completely exhausted. So signing up for something like Hand Therapy Academy, where I actually had to pay for it, was a little bit more of a kick in the butt for me. It was nice because they had weekly meetup sessions where you had to have something done by that session. So I found that really helpful, and then I don't do well sitting in front of recorded lectures. So for me, the Purple Book was also very helpful, as were some other practice tests, because sitting down and taking a test over that period of time you've blocked off and then going over why you got things right and why you got things wrong was really valuable for me. And then also applying those to the patients that I currently was seeing. So that was the best way that I learned practice tests.
Okay, great. We have a lot of people that make comments that they are having a hard time studying because they are raising children, or there's a lot of things personal things that are getting in the way. So does anybody want to talk about how you address the balance between studying and your personal life, and how you address that balance, and what did you do?
So my work schedule, I do have 410s. So I knew for the days where I would have like a longer, like 10 to 12 hour day, I typically didn't study on those days because I didn't want to force myself to do something. But definitely on the days off where I did have it, I did dedicate maybe like 3 or 4 hours where I knew I would learn best in the morning, to go over some of the lectures or maybe to just kind of learn something new. Definitely closer to the exam date when I there was like less time and everything, I did purposely take PTO off on certain days just so I knew, okay, on a Wednesday I can just breathe and just do my own thing rather than here's 4 weeks of like leading up to the exam. But I think I kind of picked and chose like certain things. So it's like on a day where I knew I was a little bit more tired, I'd maybe rewatch something as a review, rather than learn something new on that day.
I definitely think that pacing yourself is really important, and like you had mentioned, like the 6-month timeline is overwhelming. Like even if you have all that time to dedicate, it will burn you. I mean, not everyone, but it burned me out too. Like I definitely studied shorter like amounts of time. I made sure to even like block time in for exercise because that was really important. And then I found I studied better after I exercised. It kind of like woke me up. And just, I also, just wanted to make sure, yes, I told my people that I was going to be, this was like a huge commitment, but then also taking time. Like I worked 2 long days and 3 shorter days, and my 2 long days, I didn't even look at the books. Like I knew that was just work. You come home, you zone out, whatever. My earlier days, I would usually, work and then maybe exercise and then maybe give myself like 2 hours. And I did find that if I gave myself a schedule, that I'm actually more of like a scheduled person. I didn't like to think that I was, but I need structure. And once you're in it, it's hard to get out of it. Like after I took the test, I found myself like reaching for my notes in my books because I was like, it had filled so many blocks of time and had become my new norm. I was like, how do I go back to life after this? But so it really is like finding out like what your priorities are, setting the schedule, setting the calendar, and making that time work for you so that you're not dreading the studying, and if you're, not dreading it or resenting it, then you'll want to do it.
First thing I did was talk to my work about decreasing my hours for 6 months by 4 hours a week, and that was really helpful for extra time, just to set aside a couple hours here and there. And the other thing is I don't think, other than taking practice tests, I don't think I sat down and studied for like a 4-hour block of time. I just can't do that. So for me, really picking a time each day to study was helpful. I'm lucky enough that my husband agreed to make dinner every night for me so that I could study during that time. So I was really grateful to him. I talked to him about that. I was like, if you are able to do this for at least 6 months, like I think that would be really helpful for me, and it allowed me to still be present in other ways, and then also exercise, because that's really important for me, a big part of every day, and that's just, can't take a back
I'm
seat.
going to have Carrie chime in, because Carrie, when she took the test, I believe she had a private practice and several babies. So why don't you address this, Carrie?
I did, and it's all about just making your life work around what you're trying to do. So making a schedule was the most important thing to me. Certainly, carving out time for my family was imperative. I had to be there for certain things, but carving out time was the most important thing. And it wasn't the same for me every week. I was in private practice. I had little ones at home, and so I just had to stick with a calendar and a calendar of events that when I knew I could have time. And I relied on my parents a lot, so they were there for me. Leaning on the resources that you have are important, and scheduling for me. I also wanted to add one thing here to this comment. Our stats show that those people that study less than 6 months don't do as well or perform as well on the exam as those that study between 6 months and 1 year. And those that study greater than 1 year or 1 to 3 years also don't perform as well as those. So the magic window, it seems, for us is those that are studying between 6 months and 1 year before the exam.
I'd like to address this question to you, Katie, because I know you took the exam more than once. What did you do in the year that you passed the exam that was different than the year that you were not successful?
I went to therapy, and I'll be honest. I had a lot going on in my life. I have anxiety, and it was an opportunity for me I actually sat with a mentor of mine, and we went through the score report, and I almost passed. Like, it's heartbreaking how close that score was. And so we talked about it, and I was brutally honest with myself, and I didn't trust my knowledge. I changed 25 answers, and I know I had a lot of those answers right. And I don't think it was the content. I think it was the test-taking anxiety. I think it was the stress. The first time I took it, I didn't tell my coworkers. I just kind of tried to power through myself. I don't know about you guys, but like keeping a secret and studying for a test is like the worst combination possible. So the second time I was just like, who cares? Like, there's no shame in this. Like, this is a very hard exam. This takes up a lot of time in your life. It's a huge commitment. And it didn't take the knowledge away that I had learned while I was studying the first time. So I just kind of had a little like, let's get down to let's figure this out. What's bothering you? What's keeping you from this content? And I needed a confidence boost, and I needed those mental pep talks. And I reached out to my people, and my job supported me, my coworkers supported me, my family, and everyone was like, "We see how hard you're working. How can we be of service?" And my colleagues let me explain concepts. Like they went over test questions at lunch. Like it was like a let's go team approach. And I will say it even felt even better because when I got those results, I was at work and there was a lot of hugging and crying, and it was just like because I felt like we all did it together, and it made our whole clinic better, because I had that confidence and I was able to help mentor younger people as well. And there is, I will say, like, you know, if you don't pass that first time, keep going. Like, you'll get it. Like, it's not that you're not smart enough. It's not that you don't know the content. It's a 200 question test in a really cramped, hot testing room, and you just got to get over all that, and the benefits are so much better afterwards.
Thank you.
Yeah, and I'd like to add, on that note, if you pass the exam, you just get an indication that you passed, and you don't get your score. If you are not successful on the exam, then you do get a breakdown of the 4 major domains that we're testing in: assessment, planning care, interventions, and intervention of care, and then basic science. And so those 4 domains, and you'll get a breakdown of how you performed in those domains. So it should give you a little bit of help in studying again.
Perfect. So let's talk about the day of the test. Sophia, do you have any tips about actual taking of the exam itself?
The day of the exam, I brought a lot of snacks because I knew I'd be hungry. Definitely had coffee early in the morning. I think I just needed like an hour to just like keep everything chill. I like called my best friend, make sure we're all good, and they gave kind of like that last pep talk before going in. I did go in a little earlier than when they said to like go in and like do the registration and whatnot for the test. And for me, that makes me feel a little bit better, rather than, okay, they said go in at 8:30 and now I'm in line at 8:30. Now there's like 10 other people in line waiting for their test. But I think one thing prior to the test that I wish I'd done was I wish I drew the brachial plexus with a pencil, because I'm definitely one of those people where I have my favorite pen and my favorite like whiteout, and like I think that kind of threw me off a little bit, which I was not expecting.
Use a pencil and forever.
Yeah.
It's loud. You're like writing, and you're like, ah.
Yeah, but also the day of, I'm like used to sitting cross-legged because I'm like, I'm gonna be as comfy as possible to take the test. My proctor did not let me do that, so it threw me off a little, but I
What
think
didn't they let you do?
they didn't let me sit cross-legged.
Oh, interesting. Huh.
Yeah, so I thought that was a little interesting, so I was like, okay, whatever, you just have to roll with it. But I think prior to that, I think it was just like having your support system and having your snacks and your water just to like keep you good for the day. Because it's a marathon, it's 4 hours.
But they didn't let you bring those into the,
No,
right.
no.
yeah,
Yeah.
okay.
Choose your date really thoughtfully. I chose my date not realizing it was the morning after the presidential election. So, yeah, like, so I will just say, I am very proud of myself, because my anxiety, I look for ways for how my anxiety serves me. I was prepared. I shut my phone off at like 5. I said to my partner, I said to him, I was like, I don't want to know. I don't want to hear anything. Do not talk to me. I'm going upstairs. I'm going to look at my notes, and I'm going to bed. I woke up that morning. I did not look at my phone. I didn't turn the radio on. I rarely looked at people driving to the test, right? I was just like tunnel vision, like, just get through this. I walked in the door. I was the first person there, because that's how I live too. And those proctors, there's no small talk. There's nothing. They zip your stuff up in a bag. I had a hoodie. That counted as a jacket, so like I was next to people who were literally in like tank tops, because like whatever sweater they had, it was counted as a jacket and they had to take it. So just wear layers. And I was hermetically sealed in a room till 1 o'clock, and then I could like go back to the world. But I had to plan that because I didn't need another distraction. I was like, and I actually encourage people to do that regardless of what day it is, but that was a particularly like a lot of stuff was going on, so I just say, look at the calendar before you book your test.
Yeah, I booked my date because I knew the next day there would be a concert I wanted to go to, so I picked that date, slept for 12 hours, and then went to the concert.
And I would like to say that it is a good idea to find out where your test center is.
Yes.
To maybe take a dry test run, see where the parking is, take in consideration traffic, because if you're late, they won't let you in. And it's happened not frequently, but it has happened, and it's really unfortunate.
And your name, make sure your name matches the name that you registered with. I was next to someone who had a problem with their ID. It was like a whole debacle. So, just practice and preparation, it will make your morning go smoothly.
In addition to scheduling a day that you want, also scheduling a time you want. I don't know if every single test center allows you to choose the time you're going to take it, but I took my practice tests at the same time as I was going to take the actual exam as well. So that was really nice to feel like I had a rhythm in the morning. And then I also brought my bike in my car afterwards, so it was a reward for me when I was done. I had taken the whole day off and had a reward whether I felt great or not so great about the exam as well. I also got there really early and just walked around, which was nice. Yes. Didn't study, just went and got a cup of coffee and took a walk.
Also, on the day of, you are given one white sheet of paper that you can use to jot down anything you want. And a lot of people, we've heard over the years, love to just come in and get the brachial plexus out of their brain and on the paper so that that's not taking up mental energy. Or whatever lists that you've made or things you want to get down. And then you have to turn that piece of paper in at the end.
Yes,
Cannot
and I
take
think
it
if
with
you wanted a second piece of paper, they need to take the first one and then they give
Right,
you a
right.
new one.
Right.
Also, they won't allow you to start writing on the scratch paper until they start the clock on your examination.
Right.
So what about, I'll start with you, Rachel, what about the actual taking of the test? I mean, any advice on how to answer questions, on second guessing yourself, on anything regarding that part of it?
I actually felt that having a dump sheet wasn't super helpful for me. It felt like I was placing more time into what potential questions could be on the exam. So I just used that scratch paper instead for taking notes or thinking through things as they came along, and tried to go through each question and hit my gut answer and reaction first. I think it had the ability to star it, and you could go back if there was time. So just going through the exam, and if I didn't know it, saying I would come back to it, so I at least knew that I could get through most of the questions, and then just writing on that sheet when I felt like I needed it.
Yeah, you're allowed to star a question and come back to it. You're also allowed to make a comment on a question if you feel like it's flawed in any ways. And it's not to defend your own answer, they're all looked at in the aggregate at the end. But our recommendation is to get through the test first, star the ones you want to come back to, and then make your comments so that you make sure you have enough time for the exam. And if you don't know the answer, guess, because if there's no answer, you're going to get it wrong. So we definitely recommend answering every single question.
Also, we like to let you know, it's in the materials, but sometimes you don't read that far, but every test of 200 questions is scrambled, so nobody gets the same order of test, so you can't walk out of the test and go, oh, what did you do on question number 1? Because it's not going to be the same for anybody. And also the 4 answers are scrambled for each. So nobody's getting the same order of answers. So if you make a comment and say, on this question 26, letter A just didn't sound right to me, we have no way of knowing what letter A was for you or anything. But we do read those comments, and we put a lot of thought and post follow-up into those, but those kind of comments are, it's a waste of your time to kind of do it that way. You'd have to explain more. So as to Marty's advice, get through the exam, star the ones you might want to come back and think a little bit more about or comment on if it's causing you some distress.
And try not to overthink the questions. The item writers really try hard. They're not writing tricky questions. They're trying to write, standard upfront questions. So don't overthink it. I think that's a big problem that some people get into.
The best advice I got was in terms of changing answers to not change an answer unless I noticed that I read the question incorrectly. So if I missed they'll say which is not, and then if I notice that I read which is, because in that tension you blow through a question. And honestly, when I did pass, I changed no questions, and when I didn't pass, I changed 15. So I mean that's my personal experience, but you just want to I learned that through practice tests, and then taking multiple practice tests without changing my answers gave me the kind of confidence in the data that I didn't need to change them.
I think when I took the test, I wanted to make sure that I went through all the questions. So definitely if there was a question that I was stumped on and I felt like I was spending a little bit too much of time, I'd put like 25, B or D, and then I just move on to the next one and then just kind of save it for the end. So that way I still had time to finish the test, but also later on when I realized, okay, I have an hour left, then that way I can like think through it a little bit more deeply rather than I need to decide and figure out an answer at this moment.
So we hear a lot of urban myths about the examination. So what is one myth about the exam that you would like to debunk?
I mean, I guess I was, like earlier on when I heard about the exam, it was just like, don't even try, it's impossible. Or if you fail the first time, like, it's not for you. And I mean, I'm living proof that neither of those are true. It's a hard exam, but it's not impossible. And yes, if you don't pass the first time, don't lose that momentum. People are like, oh, I'll try again in a year. Like, don't get out of that rhythm. Like, just jump back in and sign up for the next one and just keep going.
I have one, and it just went out of my mind. Everyone says, oh, they're just trying to trick us. And I have to say that's really not true. We're not trying to trick you with any questions. There's only one correct answer to each question. And so if you just kind of back up and look at your science, your clinical applications, and think through the question, we're not trying to be tricky. We're not trying to trick you or test things that are so advanced that an entry-level therapist wouldn't be able to get the question or get the concept. And so rely on your knowledge, rely on what you studied, and move forward.
I think a lot of urban myths that we get is the pass rate for the examination. And maybe, Carrie, you can talk about that a little bit.
So everybody says it's too hard, you're not going to pass, it's less than 50%, but our first-time test takers pass rate is 65%. And so the number that floats out there a little bit more is the composite, which includes people that have taken the test and not been successful, and that pass rate is just a little bit lower. But we want everybody to know that this is attainable, it's doable, and your study process will let you get there.
Great. So what's one piece of advice the best piece of advice you would give somebody studying for the exam?
I'd say don't psych yourself out. I think a lot of pressure was taken off when my coworker told me, regardless of what the results are, you're still gonna have a job. So you're still gonna be seeing patients, you're still gonna do well, you're still gonna be adding more and more of what you're learning into what you're doing with your patient. I think that just reinforces, your skills as a clinician, but also your knowledge for the test as well.
I had my mentor said to me, those 3 letters, they mean something, but the knowledge behind it is more important. And studying is the journey. Like getting to the end and getting those 3 letters, yes, that's why we're all here. But don't get ahead of your skis, right? Like don't just think towards the test. Like think about the learning, and the learning will get you to the passing. So if you're sitting there just focused on like, oh my God, what if I like, that's going to cloud, that's going to impact, it's going to cause more stress and anxiety than just like, hey, I'm going to be able to treat my patients better. I'm interested in this. I'm passionate about this. And that journey it's like the one time we have where we are literally like focused on this for this complete amount of time. And that's a really unique opportunity to gain skills and gain knowledge.
And give yourself plenty of time, because it's more important for you to also have a great balance and have a life, social life. Your relationships are important, exercise is important, eating well. So just give yourself enough time so you don't feel like you can't do anything else, and be the person that you are outside of studying for this exam.
I'd like to address the next question to Carrie. we're going through a practice analysis, and a lot of the exam is based on the results of that. So Carrie, kind of walk us through the process of how the exam is developed, and how often do we revise the blueprint, and how are the questions developed? And how many people are involved in that process?
Every 5 to 7 years, we conduct a practice analysis, which is a survey to practicing hand therapists, credentialed hand therapists, and some who are non-credentialed, to get an idea of what you're doing in the clinic each and every day. And that provides, it's a survey, and it's based on the criticality and the frequency of things that you do each and every day. From that, we create the test blueprint. And the test blueprint is what the exam is made from. So there's 4 domains right now, and we anticipate that staying the way it is. So if you're studying that, there's no anticipation of big change for our domains. And the first domain is the evaluation and assessment. The second is planning care. The third is the implement of treatment. And the fourth is just basic science, the knowledge that you need behind all of those things. Items get, test blueprint is made. It's adjusted every 5 to 7 years. And we have a group of item writers that come in and write items according to the blueprint. So we're not just sitting out in some park trying to say, okay, what can we do? What can we say to these people and test them? It has to match the blueprint. It has to match the delineation that we have outlined that is the practice of hand therapy. And so items get written by item writers, and frequently the item that is written goes through 6, 10, 12. I'm going to glance over here to Hannah, who's in the first row, does our item writing review. She's written new items and item review, and probably every question that is a new item goes through how many revisions, Hannah? 4 and 12. So that item gets scrutinized by lots of people. It touches lots of hands, lots of eyes read it, so that it really is asking one specific concept, and there's one answer to that question. Those questions get placed on test, and when a question is used for the first time on an exam, we have a statistician that reviews the performance of that exam. That is the advantage to you to not getting your score when you walk out the door. Because if there's any item that it does not perform well, that item comes back to us for review. And if it was a new item and it didn't perform well, meaning 2 options may have scored well for the better test takers, then we throw that item out. And so it is to your advantage that we go through this post-review analysis so that any item that was new that did not perform well gets taken off the exam. And thus, we have scaled scoring, not just on the 200 items, but on the items that remained. And that is a statistician process that our testing company goes through. We are not in charge of that process. They do all of the analytics. They bring the questions back to us that didn't perform well, and then they score the exam.
Great, thank you. Does anybody else want to make any comments before we go to audience questions? Okay, great. Sarah? Maybe you can go by the mic, because it's being recorded.
Okay. One of the questions, and this was stated in a couple different ways, was about fellowships. If anybody here has done a fellowship, if that made you feel better prepared having done that. Does HTCC have any stats on pass rate of former fellows versus?
I think, Sophia, that's right up your alley.
So I definitely think doing a fellowship was definitely one of the best decisions I've made in my career. But with that, I will say that, like, depending on where the fellowship is, or like how it's how their program is, like, it might make, you know, that 1 year that you're doing a fellowship a little bit different than like the rest of your life. Because like for my fellowship, I went down to 0.7 FTE with the expectation that the rest of that 0.3 is going to be for like didactics. So with that, I did take a pay cut, and that was something I knew going in. The current fellowship that I am mentoring in right now, you are like a full-time employee, so you're still expected to hold up productivity, but at the same time, you learn didactics on like the 1 day that you have off. So like if you're coming from somewhere else in the US coming to California, like that's a big difference. So it's like the financial cost also makes a big difference, but also the fact that you're stepping back into like a student mode for that whole year. And when people are interviewing for the fellowship, I always tell them like every weekend you're doing something for the fellowship. It's just a matter of how much, right? It's like, are you reading a journal? Are you preparing for a presentation? Are you, kind of brushing up on something that you haven't seen before? So while it is very challenging, I do think that it was a very rewarding aspect, and I highly, highly recommend it to people who are able to interview and like step into that role.
Great, thanks. Carrie, you want to talk about the success of fellowships?
Yeah, our post-test analyses, there's a survey after that asks what kind of your training was, and so on our accumulation of that data, candidates who were in a fellowship program or had fellowship training did perform better than those that did not, but it didn't mean that they passed at a higher rate. So they may have performed better on the exam, but that didn't mean you had to take a fellowship in order to be successful on the exam.
And if you're looking for a fellowship, we do post some on our website. We offer it as a free service, but if you're offering a fellowship program, you can post it on our website. But the American Occupational Therapy Association has hand therapy fellowships that they accredit. So you might want to also go to their website as well if you're looking for a fellowship. Sarah?
Are there any online forums or groups you recommend to have others to discuss prep and just all things related to prep, just to talk about it with other people who are going through the study process?
When I was, enrolled in the virtual hand to shoulder CHT prep, there were a group like there was links to like a group support page, so like we could chat with each other and ask questions through that. And I think there was like an additional like Facebook page that you could also it was like a private, chat, whatever, as well.
I also think there are some Facebook groups that are available as well.
So HTCC does not endorse any particular resource, course, book. That's not our job. But we do encourage you to contact CHTs in your community, your online community, your social media group, and find what works for you. There are many out there. There are many programs. There are fellowships. There are self-study courses. There are practice tests. And with the digital age is so much better now. When I studied for the test, you had to find a little group in your community or sometimes drive a couple hours to get together every few weeks and go over resources that were paper. But the world is at your hands now, and there's so many resources out there. So find what works for you. ASHT offers a mentorship match program. So if you're looking for a mentor, whether it's remotely or in person, if you're a member of ASHT, you can go to their mentorship site and request to find a mentor. We also, on our site, HTCC site, you can post if you're looking for either an online or in-person study group.
If something is disputed in the literature, they included an example, CMCJ primary leg stabilizer. Is it in the test, and how do you choose? Should they be referring to rehab of the hand?
So every item on the exam has to have a reference, and we try to stick to that. If there's any time that there's one protocol calls for something to happen at 3 to 5 weeks, and another protocol for it to happen at 4 to 6 weeks, then obviously those are overlap between the 3 and the 5 and the 4 to 6. We take that out, or we put the time frame that would say between 3 and 6. So we try to look at references. That's what our item review panel does, is look at that reference of the item and compares it to other references that may be out there. If there is any conflict, our item review panels spend hours doing this. And so we try really hard to make the items so that there is not that conflict. And it's not just rehab of the hand, it's the references that are out there.
Is the test harder or easier than you expected?
I don't really know what my score was since I did pass. I think that it was a little bit easier than I expected because I left feeling not like total garbage. I was expecting to feel terrible no matter what, and I was like, well, I only feel a little bit bad about leaving this. I thought it was a little bit easier, and I knew a lot more than I was tested on because there's so much information. When I was studying, I was like, oh, they didn't really ask me anything about this whole category because you just don't know what's going to be on there.
I think that the first time I took it, I think I had expected it to just literally be impossible. And I think both times I was pleasantly surprised that like I had done the due diligence, I'd practiced reading the questions. And I think that's what can throw you off. You read a question, if you're not used to it, and the first one, if you don't know it, it can throw you off for the whole, like for a test. And so practicing understanding like what domain is the question asking about, like what do they want to know, it's just like any reading, it's really reading comprehension. It's like, how can you read this question and break it down?
I think there were definitely certain questions that made me pause and think a little bit more, but there were definitely certain questions where I was like, I knew it right off the bat and I was able to move on to the next thing. So I think it's a little bit hard for me to say like whether it was a little harder or easier, but I think if anything, it's more of just like, you're just in the like testing zone. And I think that, if anything, was like harder than the content of the test. It's just like, don't psych yourself out.
And there was a question, kind of back to Rachel's point, about why there is no breakdown for people who do pass.
The test is meant to be that if you meet the standard, you meet the standard. That if you pass the exam, you're a certified hand therapist. You just met the standard. If you shared results with people, we don't want people to say, well, on the resume, well, I got 90% on the exam, and it's not meant for that. It's just meant that if you meet the standard, it's been met.
That was not the question I wanted to ask. Hold on. What did you do when you felt like you were completely stumped in the test? Like even if you started to come back to it later and you still had no idea?
I feel like there's always something, like you just have to like read the question, and if you're completely stumped, like stop for a second, and then I would ask myself like, what can I pick out the domain? Is this about prognosis? Is this about the anatomy? And then look at the verbiage, and the words are there, and like you just reminding yourself like all the info that you need to answer this question is in the question. And then if I truly didn't know, I would just take a best guess and move on.
Also, maybe when you come back to your second round of your starred questions, if it's one that truly stumped you, don't spend too much time on it. Go on to ones that maybe are a little bit challenging, and then coming back again if you need to for those ones so that you don't end up spending 5 or 10 minutes on one question, because in the grand scheme of things, it's just one question.
Sarah, I'm sure, has more, but does anybody want to come to the mic and ask a question personally? Jane, you're going to have to come way up. You're the same age as me.
I know.
You're not old. We're old.
We did wear the progressives up.
Good.
Have you guys embedded any video into your questions yet?
Not yet.
What's
We're-
the
we're-
timeline?
That's something, our next step is to putting more graphics on, and so we're going to updo our graphics first, and then see how that goes, and then eventually go into videos.
We're hopeful 1 to 2 years.
Yeah.
Okay, and then I just want to echo something Katie said. Katie, I took the exam the day before my best friend's wedding. My very young daughter was taken to the ER because she fell and hit her head. They gave her some medicine. She got sick. And I knew nothing about it because we didn't have cell phones in the day. But I would say, in my day, we sat next to people, did a paper and pencil test. Drive yourself. Don't go with somebody. Because I was ready to leave, because I had heard about what happened, and I couldn't get home fast enough because my driving partner took too long.
Anyone else?
Is there any like stats on PTs versus OTs and what are there topics that OTs maybe struggle with more versus PTs on the exam?
I don't think we have any things about topics about which OTs do better and PTs do better. It's about your schooling and what OTs may have gotten in school that PTs didn't get. So PTs really have to brush up on orthotics if they didn't have that in school. And if OTs didn't get much modalities in school, they really have to brush up on those and what's current. But I don't think we carry any specific stats to that.
And I think it's your own personal experience, your clinical experience as well.
Right. As far as do OTs or PTs do better on the exam, that fluctuates every year, and it's dependent on what level of degree and what level of education. So, we have fewer PTs in the field, and it's about 15% PTs to the rest OTs. And so it's hard to compare necessarily because it's a smaller population and a smaller group taking the test. We every year have a few therapists that are both OT-PTs as well, and that population is small, but they tend to do very well on the exam. But every year it's a little bit different.
Hi, I come from a more non-traditional setting as I'm prepping for the CHT. I did take this last year and do a fellowship, which I thought was super helpful, but I'm back in pediatrics, expanding our ortho and peds resources, and I'm still in close connection with our CHTs, but, and maybe Rachel, you have any advice, like coming from the emergency room? My timeline seems a little bit longer in accumulating my hours, but do you have any advice for like not coming from a traditional like outpatient hand therapy setting and prep for that?
Coming from acute care and emergency care, I actually was fortunate enough to get a job where I could accumulate those hours pretty fast, so I'm not probably the best in terms of accumulating them on the slower side.
The panelists you have something?
No, we have lots of therapists that sign up for the exam, and they are possibly in a nursing home setting or skilled nursing settings, and they do take a little bit longer to accumulate their hours. But we don't have any stats that necessarily say that once you accumulate the hours in hand therapy practice, then that's the standard that we've set to say that you've treated them. The difference is the different diagnoses that you're treating. So if you're in a different setting and you're not getting a variety of diagnoses, that seems to be the indicator. So when you treat the patient, it takes the knowledge that you've learned and it kind of solidifies it. You're like, oh, this is what that means. And you feel it and you see it and you touch it. So it's the different diagnoses rather than the background.
And we are seeing more and more pediatric hand therapists, so.
I'll let the pediatric specialty today.
Great. The panelists have agreed to stay a little bit extra. Well, I didn't ask you to, but.
We're fine.
So if you have personal questions after we're done here, please come up and they'd be glad to answer those questions. We're going to have, did you all get your scratch and win tickets? Any winners? No, okay. This will be recorded, this has been recorded, and it's going to be on our website on a special landing page if you want to look at it again or share it with somebody. The questions that were not answered, Sarah, were there a lot? Yeah, we'll try to answer those and get those on that landing page too. So we'll try to send you an email to let you know when that's available for you to go in there and take a look at the questions that we weren't able to answer. And I thank you, everyone, for being here, and I congratulate you on making this journey.